Welcome to our series on communication and consultation skills. Today we're going to look at the difference between being patient-centered and patient-led. Just before we get into it, if you've not already subscribed, do subscribe to the channel so you can get notified when the next video goes live. So, one of the things that you want to demonstrate as part of interpersonal skills or relating to others is being patient-centered or person-centered. So, some doctors can sometimes confuse being patient-centered with being patient-led. And so if you're being patient-led, you might just agree to whatever the patient wants, because in your mind you see that if I make the patient happy, that's a success. That's not our job. Our job is to keep the patient healthy. If we can keep them happy on top, that's great, right? But if a patient wants something that would be inappropriate or might be unsafe for them, giving them what they want because they've asked for it would actually be unsafe. You're not doing your job as being a good doctor, are you? So a good consultation is patient-centered but doctor-led, i.e. you take on board their perspectives, you take on board how it might impact them, you're respectful of how it might make them feel, but you're the one in charge, you're the one with the training, you're the one that needs to decide clinically is it appropriate. I'll give you an example. If someone confused being patient-centered with being patient-led, if a patient demanded antibiotics and it was inappropriate because they got a viral infection, if you just give it to them, that's being patient-led. The patient will be very happy. You've done whatever they've asked, but that's the wrong thing to do. It's going to lead to a fail in management. You've done the wrong thing according to the current clinical guidelines. Whereas if you're patient-centered but doctor-led, you'll assess that it's not the appropriate thing to do, but you're going to be mindful of why were they so worried, how would it impact them. Maybe the reason they wanted antibiotics is they're really struggling with finishing an important project at work and they think that the antibiotics are going to help them get better from this viral illness, and therefore they think that that will help them finish their project. If you're patient-centered, you will have explored that, you would have seen the impact on their work life, found out about their home situation, and you'll take that on board and you might use that in your explanation. Now I can see that you really care about finishing this important project at work because you've mentioned that it might help you get a promotion. The good news is that you don't need antibiotics because what you've got here is a really bad cold. Now, a really bad cold can make you feel awful. And, like the way you've described, you said you've got no energy, you've got this runny nose, you just feel your head's full of cold, that's just making you feel a little bit groggy. I appreciate that must make it really difficult for you to stay on top of your work. Now, antibiotics will not help that at all because they don't work on colds. In fact, they might make you worse. And I can imagine that's the last thing you want. The last thing you want is side effects from antibiotics that aren't helping your cold, but giving you things like sickness, diarrhea, because that might mean even more time off work. What might really help is if you had a few days to rest and let your body fight off this virus on its own, this bad cold on its own, then you might be able to get back to work sooner, but be back at 100% and be more effective. What are your thoughts on that? Can you see? Patient-centered, you've taken on board and you've highlighted that you're listening to them and you understand why it's important to them, but you're doing the right thing clinically. You're in charge. Similarly, let's say a patient wants an x-ray of their back, but from history and examination, this looks like a musculoskeletal problem, a sprain, no evidence of a fracture. Do you see, if you send them for an x-ray, that's being patient-led. You've done what they want. They'd be very happy, but you're going to fail the case. You're going to fail the management because what you've done is unsafe. You've got no clinical indication to give them a significant dose of radiation. Whereas if you're patient-centered but doctor-led, you'd find out why do they want this x-ray, and it might be they're worried that it's something serious. Look, I can see that you're really worried that you might have a serious injury to your back and that might affect you doing your job. You mentioned there's a lot of heavy lifting in your work. Thankfully, from examining you and from the history that you've given, this looks like it's a problem in the muscles, a significant sprain, but there's nothing to suggest there's any breaks in the bones, and that's what would show in an x-ray. A sprain won't show in an x-ray, so it would be unsafe and inappropriate to give you a significant dose of radiation for no benefit. We'd get no useful information about a sprain from an x-ray. You haven't got a fracture. That's something that would show on an x-ray. But, a sprain in the muscles won't show on an x-ray. Now the patient understands. But can you see, so you've done the right thing clinically, but you've still shown that you can appreciate it's important to them to get back to work. So then you can talk about how you can help with that. If we give you the right combination of painkillers to not just help with the pain, but bring down the swelling in your muscles, and that combined with some exercises for your back. That might help you get back to work sooner rather than later. Would you like to discuss that in more detail? And now you can lead the conversation back to how you can help the patient. You see, patient-centered, they're at the heart of the consultation. You're thinking about the impact on their job. You're thinking about what's important to them, what they're worried about. But doctor-led, you're in charge of the consultation. Okay, so just to recap, a really good consultation is patient-centered and doctor-led. You're in charge, you're the one with the training, but of course you respect the patient, you take on board their ideas, concerns and expectations, you find out what they're worried about, you see how it might impact them in their home and their work, and you explain those things. But you don't just do whatever the patient wants, or whatever they ask, or whatever they demand, because sometimes what they want might be unsafe, it might not be the right thing, it might not be appropriate, it might actually cause harm, not good. So patient-centered, doctor-led. Hope that's helpful. If you have found this helpful, do subscribe, and I'll see you for the next one.